I'm going to highlight several things that we are doing and will be doing over the course of the next literally few days. We will be moving on a regional basis to assessment centres for testing. Those people identified by screening and after consultation with public health will be given appointments for testing centres. Each region will have a number of these. The locations will be worked out over the course of the next couple of days. Certainly for the island portion of the province, I'm aware that the three regional health authorities on the island are looking at a drive-through model. This is efficient, by appointment, and will minimize exposure of public and staff to what risk may be there. Labrador Grenfell, looking at the Labrador portion of the province, may opt to do things slightly differently, simply to reflect their geography and not surprisingly, the weather. These will be done on the basis of recommendations from public health and from testing, and I would refer anyone who is at all worried to our website, 811healthline.ca, to perform a self-assessment and then be guided by the results of that. One of the social distancing issues that we have seen has been around requests for virtual care, where the provider and the patient or recipient of care don't actually have to physically either travel or meet face-to-face. And I'm pleased to say, as of the last hour or so, we've reached an agreement with the Newfoundland and Labrador Medical Association to provide virtual care immediately. In actual fact, we will retroactively compensate physicians who have been doing this going back to the start of our emergency health declaration. We, through the Newfoundland and Labrador Centre for Health Information, are happy to provide a free platform for those physicians who don't have one, and we will also provide free support for that platform. If you as a physician already have a platform, you can continue to use the platform you are, and obviously you would have your own support arrangements. This ability for virtual care applies to any family practitioner, any specialist. It applies to care delivered by phone for those people who have bandwidth issues or those people who use a virtual care platform. We've heard concerns over drug supply and pharmacies, and we are aware from our contact with the Pharmacists Association that wholesalers, for reasons which we are looking into and exploring, are actually being cautious with their drug supplies. As a result of that, prescription refills now through the pharmacists will be for 30 days. We're looking at ways to support seniors and people on drug cards who would otherwise have to pay an unusual amount of dispense fees. We would advise that anybody who wants to have a prescription renewed, call ahead to their pharmacy. There are certain categories of medication for which script renewal automatically may not be appropriate, and I'm thinking of antibiotics here where we don't want to overuse them, and controlled drugs which are actually subject to federal regulations which are slightly different. These pharmacies, some of them as well, have also expressed an interest and an ability to manufacture hand sanitizer, and we have cut through the red tape to enable that to happen. And as far as I'm aware, as coming to this meeting, what obstacles exist are simply logistic now for the pharmacies in terms of getting their ingredients, mixing them and distributing them. To move on to the issue of equipment, we have been keeping a very close eye on our supplies, our consumables, our PPE as we've called it, personal protective equipment. We have daily inventories being prepared. I had a lengthy conversation with Minister Haidu yesterday to make sure that we have an itemized list by the end of today from her about what supplies we have ordered, where they are, what the numbers are, and when we can expect delivery dates. We had heard concerns raised about ventilators. We actually have a better ratio of ICU beds in this province than, for example, the state of New York. We have 50% more ventilators than we do ICU beds, but we have gone to the federal supply chain and asked them for another 20, and that order was placed as recently as this morning. So again, our main focus is around looking at the current problems, how we can best deal with them. Our best defense is containment and isolation, and I would urge everyone in the province to exercise their responsibility as a resident and a citizen of this province to protect themselves, to protect their families, and to protect their loved ones by following the instructions and recommendations that we have put out about social distancing, about minimizing gatherings. It will be a challenge. I had teenage girls once myself, and I know that it's very difficult to keep them apart, particularly now they have time on their hands. Whatever we can do to help you with that, we will try our best. But again, it's down to each and every one of us to help ourselves.